No, or next talk is on a very important topic, which is the clinical audit. It is basically the need of our, not only in the state-run hospital, but also in the private hospitals. For this clinical talk, we have Professor Zafar Mehmood Sahab. He is the consultant physician, Lady Reading Hospital. He is the fellow, Royal College of Physician and Surgeon, Glasgow. He remained the medical director and chairman, medicine and allied department in LRH. And he's also chairman of Quality Improvement and Infectious Control Committee. Sir, please take the stage.
Assalamu alaikum, and thank you very much for asking me to deliver this topic. I was hoping, because this is aimed at trainees and junior doctors more, because as you know, not here, but you know, if you apply and go abroad, you are asked about clinical audit virtually from very junior post to a consultant post. So you are asked about clinical audit. And as you know, we are obviously, this 4 days of very sort of, conference with lots of hardcore medical topics. So you can imagine that medicine is evolving all the time, newer treatments, newer technologies, newer pathways and guidelines, they are coming every day. So what happens is that we need to, pause and think that what we are doing, what we are supposed to be doing, are we doing those kind of things? So clinical audit obviously is an important, and clinical audit basically tells us about how to make ourselves accountable, to make sure that we are doing the right things. So this is a very sort of brief few slides just to convey, the message and convey some sort of ideas for you to then go and do clinical audits in your own sort of areas. So basically, we want to understand what clinical audit is, why it is important, what is the difference between audit and research. A lot of people keep, thinking and talking about research, so we need to know as to what is the difference there, how do we select a topic for it, what are the steps, and how do we complete an audit loop, and how do we implement the change. So basically, as I said, it's a quality improvement process that basically seeks to improve patient care. So the ultimate aim of whatever we do is to improve patient care. So clinical audit is just that. It just tells us as to whether we are doing the right things, whether we are doing, following the guidelines, and whether we are doing the pathways. So this basically tells us our deficiencies and gaps in our practice. So basically, this is our performance which we are reviewing, and it basically just to make sure that we are doing the right things. And if we are not doing those things, it just tells us as to how and what shall we do to sort of implement and monitor those things. So as you all know, this was the basic thing I wanted to convey. So research basically tells us what the best way. So research is a complex, meticulous thing. And it just tells us what is the best way. And then there are guidelines. So guidelines then tells us that this is the best way. This pathway is the best way. And this is based on the best available research. So audit is, does our practice matches the best way? So basically, it is our practice which we are evaluating. Just a brief, as I mentioned, research is creating new knowledge. It's complex. They are large-scale studies. They need ethical approval. They need complex statistics, and rigorous methodology. While audit does not have any of those things. Audit is, you don't invent anything. You do not do any experiment in it. All you are doing is that you have a standard and you are just checking that your practice is as good as, the guideline or the standard practices. So this is an important step. So one is best practice, which is there in the guidelines, and one is the actual practice we are doing. So basically, audit is the gap, and it bridges the gap between our practice and what we are supposed to be doing. So it's, basically it's everybody's job. We are here as a sort of physicians, senior consultants. We are medical leaders in our own sort of areas of expertise and our departments. So we are responsible, and virtually everyone is responsible to do clinical audit. So we have talked about it, that basically audit is all about, making sure that we are meeting the standards. So we talk a lot about governance, and governance is basically a building based on those pillars. So these are the 7 pillars, and clinical audit, as you see, is the most important and one of the important pillar of clinical governance. So clinical governance is basically accountability. Any organization where we are working in is basically accountable to make sure that they provide the best to their patient and customers. So the clinical governance building is based on these 7 pillars, and audit is one of the most important thing there. So she is the founder of modern nursing, and basically she, found out, she was in Crimean War, and she found out that there were lots of these infections. Soldiers were dying of these wound infections. And she was clever enough to find out that basically if we keep washing our hands between the patients, it will and it had significantly reduced the wound infection rate. So she, in our sort of knowledge, was the pioneer of what audit is. So, to do an audit, you first identify a problem as to what is the problem. Do you have a lot of post-op infections in your clinical area? Do you have a long waiting time, for example, in your sort of clinical setting? Do you have, you think that there is a sort of a shortage of equipment, for example, which is affecting patient care? So, or do you think that there is maybe shortage of staffing, technicians, doctors, nurses in your clinical area, which is affecting clinical patient care? So basically you identify the problem. That is the first step of doing an audit. The second step is we define audit, that this is obviously comparing your practice to a standard practice. So the second step is that you identify whether you have a guideline or pathway and for that particular sort of, so for example, I'll give you an example that we all know that every sort of patient who is non-ambulant, a medical sick patient or a surgical patient should have a prophylaxis Clexane, for example. So we know that there is a standard, everyone should have it unless there is a contraindication to it. So we have a clear pathway and guideline there. So we can, identify, we can audit our practice that is in our setting. Are we prescribing Clexane, for example, to all the patient who requires it? So important is that you cannot do an audit if you do not have a standard. So the standard may be your local, it may be sort of your local hospital guideline, it may be a national guideline, or it may be an international guideline if you do not have any local or national one. So once you identify a problem and you have an explicit guideline criteria, then you start collecting data. So I'll give you an example that in my hospital where I work, there is a requirement that every patient who is admitted all the documentation, history, and examination should be done on a computer, HIMS. So basically, an audit will be that, are we doing, are we putting everyone's patient data in the computer within the first 24 hours of admission? So we have, a standard, and then we compare, the standard with it. So we will collect the data for the patient and see whether every patient who were admitted, they had their history and examination and they are receiving notes, for example, in the computer within 24 hours, and they were seen by a consultant within 24 hours. So we collect all the data and then we analyze the data, okay? So once we analyze the data, then we compare this data to what the standard should be. So obviously the standard is 100%. We should be examining, we should be taking history, and we should be documenting each and every patient. So if there is any sort of deficiency there, then you find out as to what is the reason for that. What is the reason? Do we not have enough doctors, for example, or are we getting a large number of patients? No, that's why we are missing some of them. Or do we not have enough equipment, for example, computers, for our junior doctors to sit and document all the notes in a computer. So once you find a problem, then you try to implement that change, that, okay, we found out that we, on a particular on-call shift, because of the number of patients, there were 2 doctors available. They are not able to document all the histories and examination. So would it be worthwhile putting another 2, to cover that? Or we may find out that there aren't enough computers, for example. So we then, what I'm trying to say is that audit is all about trying to sort of, evaluate the practice and try to then find out where the problems are and try to implement that change. So basically, for you, the juniors, there aren't many here. I was trying to obviously address to them. How do you sort of choose an audit topic? So you can audit a structural problem, for example. So you can sort of audit staffing issues, you can audit equipment issues, you can audit your resources. So for example, I'll go back to my hospital. So we were told that, all the patients who are having major surgeries should have a consultant anesthetist available. So, we can audit and say that, do we have enough anesthetists, for example? Do we have enough of them to sort of cover each and every surgery? So, staffing. The same is, equipment. Processes, you can, audit your sort of process. So, for example, there is a standard that before each surgery, a surgeon should fill a perioperative form. So we can audit that all these surgeons, are they sort of completing those forms? So this is a process. We can sort of audit that process. The same is equipment. I have already mentioned it. And the processes, for example, are we sticking to the antibiotic guidelines before prescribing it? Are we sending cultures, for example, before we start antibiotics? So these are the processes. And then you can audit an outcome, for example. So outcome may be, we are thrombolizing patients, and TPA is a very, very expensive treatment. So do we have sort of mechanisms to sort of follow up these patients and check their NIH scores at, for example, 1 month, 2 months, and 3 months to sort of know what the outcomes are? Because if we don't know, then there is no point of giving such an expensive treatment. So you can audit your structural things, you can audit your processes, and you can audit your outcomes. So it's always important that you choose a topic where guideline exists. So please, this is very important because audit is all about, evaluating your practice to a standard guideline. So make sure that whatever topic you choose, there are guidelines. So we mentioned that. So implementing change, people, I run this sort of clinical audit workshop, and people ask me as to where do and how do we implement the change. So here, obviously, the leadership, administration, and those kind of people comes into picture. Because if you run an audit in your department, there is no point, it's not worth anything if you do not speak to the managers and the people who are able to then implement those change. So for example, if you need computers, if you need extra staffing, if you need extra nurses, you need administration and policy makers and senior management to help you with implementing the change. So, an audit is always worth it. If you happen to appear for any interviews, people will ask you about audit loop. So audit loop is obviously once you have done an audit and you have suggested some changes and implemented it, there is always, it's always important to then re-audit the same, after a few months, and then see whether your changes you have implemented have made any difference. So a complete, when you complete an audit loop, it makes the audit more authentic and more important. So these, the last re-evaluation. So it's always important to complete the loop, because if you have suggested and changed and implemented changes, then it is important to recheck it again to see whether the changes you have implemented have made a difference. Always be smart. You have seen this slide many times. So our hospital has a quality assurance department, and basically quality assurance is a systematic process which ensure high quality and effective care. So we have a quality assurance manager, we have a quality assurance department, and they basically continuously training you. They're running these audits continuously. They are involved in policy, and they they are involved in performance monitoring as well. So our hospital has a big department, and I will show you as in the next couple of slides what we have done so far. So, these are some of the audits which, junior doctors mainly in our hospital have done in the last year or so. There was around 60, I was told by the quality assurance department. So if you go through it, some of these topics they have audited. They may not be defined strictly as an audit, but to be honest, for the sake of, encouraging them to get themselves involved in, these processes, we have let them do their activities. But I have highlighted in red some of the audits which basically were meant that they were comparing their practice to a standard. So I, regularly run these workshops. So it involves then basically doing a project as well. Students and trainees are asked to come up with a topic and then design, a questionnaire and then suggest changes and things. So a lot of our people, a lot of our trainees, they have successfully got jobs abroad in UK and US, and they were quite happy that with the knowledge they have gained from these audits were helpful. Thank you.
Thank you, sir. Thank you so much. I request you, sir, please make a video of this clinical audit workshop and share with us. It's our humble request. No, or